As of late, the United States Medical Licensing Examination, or the USMLE, has gained a lot of popularity in the young minds of MMCRI. So we decided who better to give us the insider insights than two of our very own alumni who have matched into really, really awesome positions. So it is our pleasure to welcome Dr. Prajwala and Dr. Dayana to another episode of a new season of MedMics. My name is Samhita and I'll be your host for today. So if we could just have a small introduction from the two of you, that'd be great.
Sure. Thank you so much for having us, Samhita. It's great to be here after all MMC in one's MMC and all this. So yeah, my name is Prajwala and I matched into pathology at West Virginia University School of Medicine this year. So unlike in India, pathology is actually a competitive specialty to match into in the US. So I'm really glad that I matched this year, and it's great to be here. And if you have any questions, I'd be happy to answer them.
Congratulations on matching.
Congratulations, Prajwala.
Thank you.
Hi, my name is Dayana. I'm also an alumni from MMC. I graduated in 2022 and currently I'm matched at Kern Medical Center at California into IM. And I'm so happy to be here and answer all your questions. And thank you for having me.
So the question was like, why USMLE and why not NEET PG or INI-CT or anything else, you know? What was your main motivating factor?
Well, there were many things to consider, as I'm sure all of you are considering right now, because with NEET and INI-CT these days, the competition, the rat race basically is like too much. And while USMLE is equally hard, it's like a long process, but the exams have always been like nice because they test you intellectually, and that's something that got me started in that direction. And also the process itself, it can be like very where you discover yourself. It can be enlightening. All of this has helped guide me towards the USMLE.
Right. And what about you, Dayana? Why USMLE?
So I started thinking about USMLE in my second year of medical school when I was studying pathology and I discovered pathoma. And I really fell in love how they teach over there and how the concepts are really set from the basics and the understanding perspective. So I really liked the way it was presented. And so I wanted to study more into it. And then I discovered first aid. And I thought, okay, I should give this a try because I really like the concepts and the way it's presented. And that's why I really like the USMLE exams as well, like the questions, how you have to learn to basically learn the strategy to get the answer right by looking at it more clinically. So that's why I went into USMLE and then discovered that this was the right path for me. So I just I basically put the dots together in the end. So that's what I did.
Right. That's actually such a cool and unique reason because the first time I saw the first aid textbook, I was just like, I can't. I physically cannot because I understood nothing. The biochemistry section was just letters and words stringed together, and I couldn't make sense of it at all until I actually started watching the BNB videos and stuff. So that's actually really cool. But yeah. What was life like at MMC as an undergraduate student?
So in MMC, I really liked the festivities and how the cultural it was. I made sure to participate in them as well, and also the sports part of it. And in final year, since we were the COVID batch and we didn't get to experience final year, I was really disappointed. But that was the time which gave me some time to study for my step one. So I think it worked out somehow. So everything happens for the best. So I really liked MMC in that way, that I was able to develop like this huge family and connections. And also, there are so many alumni already there in the US, which I didn't know. And since because of my seniors in MMC, I got to even know about them. So I'm really grateful.
That's
Yes,
cool. That is
definitely. And I would
very
like to
nice.
add that Mysore itself, the city, is like an amazing place, and you can get like from
Yes.
like the beta to college to anywhere literally in 20 minutes. And yeah, that's been like really cool for me because that helped me realize that I love to travel and explore stuff. So yeah, that and everything else, Dina.
And I mean, like going from Bangalore traffic to Mysore roads is just heaven because I can't deal with traffic back home anymore. It's a thing. We've been spoiled by
Yeah,
Mysore.
yeah, it's peace.
Um, I've actually had a question for both of you since we started. Was pathology and internal medicine like your main thing that you wanted to do since first year? Like maybe when you were in first year, you wanted to do something different, or maybe you thought you liked something else, but now you're doing something completely different. Was it like that? Or had you
Oh
always
yeah,
known
for
that
me,
that was what you wanted to do?
it was a total surprise for me because I went from wanting to do surgery and then figuring out how hectic surgery was going to
I
be, and
think that's
then
a stage. I think that's a phase
yeah,
everybody goes through. They're
oh,
like, I want to be a
yeah,
neurosurgeon.
definitely, that was me. But I still wanted to do something in neurology, so I did a rotation in the US in neurology actually, and then that also turned out to be not fitting for me because most of the patients were chronic and rather than a cure, neurology is about long-term treatment, so that wasn't really my style. So I then randomly went to a pathology rotation, and that's when I discovered that that was like really cool and the thing that I really wanted to do because I wanted to get into diagnosis and actually look at the evidence behind the medicine. So that's what started me on my path towards pathology.
That's cool. That is very, very cool. And what about
Yeah,
you, Diana? Like, did you always want to match into internal medicine?
not really. So in the beginning of second year, as I said, I really wanted to do surgery. It was my third term, and like there was this sir called Chandru sir, and he was like my
Oh,
role model.
we still have him. We still have him.
So
Yeah.
I really liked surgery because of him. And as I went through medical school, I realized that I'm not really that much of a surgery hands-on person. I really like to think with my like I like to be more intellectual and more curious on some topics and also research on things. So that's when during internship, that's when it hit me that I think it's not for me. Like surgery is not at all for me. It's and so I switched to
Right.
internal medicine because I wanted to like go deep into the medicine field and see where I would be. I still want to see what fellowship I want to do. That's still a question for me. So I really want to see where I'll go.
Yes, that's nice. I think this should be a new hypothesis. Every medical student who starts MBBS will want to do surgery at one point and then change their mind later. Whether or
Yeah.
not they do surgery again is a good question. So we're gonna get started with some more USMLE specific questions. So like at what point in your education did you decide that you'd actually consider doing USMLE? And what would you say is a good point or a good time to start thinking about it?
For me, it was very early on because I always wanted to go to the US at some point. So in high school, I was in this thing called a world school. I still don't know what that means, but I had a lot of international classmates, and I saw like how their lifestyle and how like they were, and compared to like many opportunities we see in India, and I always wanted to go there. So I wrote the SATs and everything. So I started, I think, thinking about USMLE since the second year when in Samskriti's Fest, there was a speech by a 2K13 senior, Vishwajit, and yeah, that's when I was like, okay, I want to do this, and went full steam ahead. So
So pretty early on, you had decided pretty early on that, you just had your sights set on the USMLE. That's actually very nice. What about you then? Like, at what point did you decide that, you know what, this is what I'm gonna do?
So this was in the ending of the COVID lockdown. That's when I realized I think I'm just wasting away my time and I need to think about like what I need to do next. And that's when I thought I should take up USMLE and try to crack step one before I start going into my final year of MBBS. That's basically after lockdown, we had to get through the exams. So, but unfortunately, I was not able to do that. But still, I stuck on to my plan, and I still tried to complete it before internship. So, I would say like
Right.
try to begin even earlier, like maybe in third year of your MBBS, I would say, because that's when your knowledge is more fresh, and you'll also discover new things,
Hmm.
and you like to learn, and the that part of life is when you'll be like very curious and want to learn new things. And so I felt if I had started earlier, maybe I would have been there already, but it's okay, like I still am there. So it's just persistence. You should never give up on what you're trying to reach. So that's what I would say.
So, like,
yeah,
no
I
matter which
agree.
timeline you follow, as long as you just reach your end result, I guess it shouldn't matter
Yeah.
too much, I guess, is what I'm hearing.
Yes.
So, according to you, what was the most important part of your journey, and how were you able to work on it at MMC, if you were?
The
So
most
I would
important.
say the most important part was actually getting started. Once I found out that I wanted to do it, I had to read through everything and go through everything because it's a huge journey. That's the one thing I would like to emphasize. For like the beginners, it is a very huge journey. So by the time you get to the end, you might not know why you originally started, but to get started itself, you need a lot of persistence, and of course, helpful seniors are always a gold mine, like I had specialties. And so, yeah, that's basically the hardest thing to get started.
That's actually really sweet that you guys had amazing seniors. And I mean, we have you, so we will continue looking to you for answers. I hope that's okay.
Of course,
Yeah,
it is
that's
always
totally
okay.
okay.
And what about you, Dana? Like, what did you feel was the most important part of your journey? And how were you able to work on it at MMC?
So as soon as I finished my step one exam, it was like a shock to me that I got like, was this a right decision that I did? And it was kind of like anxiety inducing for me to like go ahead with this exam and pay like a whole, like it's a lot, right? Because you're paying so much of fees and you're prepared for this exam, and you put a lot into it, and then getting the result that you didn't expect is kind of like heartbreaking. It was for me, and I didn't really know what to do next. So I just gave myself time. I think that was the most important thing that I did. I gave myself time to like think about things like, is it okay for me to move forward or not? And then I decided, it's not at all a failure. Like I'm just thinking about it too much. And then I went ahead and still prepared for my step 2 exam, and I went ahead with the journey. So I think that was the important point for me, where I still stayed persistent even after thinking that this would be a red flag, or like even if this was something that would push back my application. So I feel that no one should give up on that dream, even if like something like this happens in your journey. So you just have to push forward from that place. It's not that important. Like it's not gonna matter so much. You just have to build on it. It's not gonna be like a breaking point for you. There's always gonna be a future. So that's what I felt after I matched. So that's what I would say. Like that was my important time.
That's actually really, really inspiring. It's the whole ideology of it. If it's not going to make you, it's not going to break you. So that's actually really nice. Yeah.
Yes.
So several students at MMC are planning on taking their step on this year. So what advice would you give them? Like they're just starting out, they're interested, they've looked at all the websites and they're like, I'm gonna give this exam. How would you suggest they move forward?
Well, there is a set criteria of UFAP, UWorld Pratama First Aid. And once you're done with that, I think a very important step would be to give a mock test, because that's when you get to know whether you can really crack the exam or not. But since it's now a pass fail, it's much easier. So I would recommend that they give a mock test, not because they wouldn't be able to pass the exam, but because they can test their knowledge for the step 2, because
Right,
60% of step 2 is basically step 1.
right, right.
Yeah, I agree. So basically, for step 1, it's basically the building block into your step 2. So I wouldn't neglect it, that it's pass fail and just go give the exam. I would definitely finish all the UL questions first. People would sleep on this, but I would definitely say that UL is a must, and you should start it from the beginning of your preparation. Learn to see the questions, learn to solve the questions in a strategic manner, to see what are the high yield points that you need to notice in the questions, and that begins with you doing the question. So even if you're like even if you feel that you're getting very low on UWorld, doesn't matter. UWorld is a learning tool and always will be. So just learn from the questions, read all the explanations that they give in it, and also try to review the tables that they have, and try to also see how it is in the first aid. So read first aid systematically, system wise, and then you solve the UL questions, and then see why you're getting the question wrong. So I think that is the strategy to go, and always finish the complete UL questions, and then do the wrong answers. I wouldn't recommend doing the second round, because I know that there's like 3,900 something questions right
Yeah,
now,
it's a lot of
and
questions.
I wouldn't recommend it. And definitely do the NBMEs. NBMEs are a must. So you should, even if it's like anxiety inducing, do those tracked self-assessments. It's okay.
Right. Um, how like when I was first starting out, I could not solve 40 questions in 60 minutes. Like, how did you pace yourself? And when it came to the actual exam, how did you structure your breaks and everything?
Well, that is actually really common, because when you are starting out, you don't know much, and you are learning from first
Yeah,
your world, and that's actually what you're supposed to do. But as you go on, you build your concept, you know why you got it wrong and why you got it right. And as you go on, you will have to start taking time random blocks. When you're nearing the end, I would recommend like when you're like 3 months away from the exam to make it all like timed random blocks so that you have plenty of practice. And it's not just so in your world you would solve one block, two blocks, maximum three blocks, but in the actual exam you have to solve eight blocks back to back. And
Yeah.
that is a test of endurance. I'm sure they're testing our ability to patience as well. So that's I practiced for that by taking two NBMEs back to back, and I think that really helped me figure out test day. So that's something I would recommend.
That's actually genius. Like it's 10 whole hours of just solving.
Oh yeah,
Yeah.
it can get to you, but it's one day of your willpower, and I'm sure anybody can do it if they set their mind to it.
Yeah. And what about you then? How did you structure your breaks?
So, for me, the step one exam was like I was so scared. Like it was the first time that I was giving like a 8 hour exam. I've never no one has given that long exam. This is gonna be my first time, and so like I would say, try to stay calm. Like don't try to think about what's gonna happen if I get low. Just think about what you're gonna do next. Just look at the question and then read through it, and then what's gonna be the answer. Just mark that and move on. So never double think or like
Right.
doubt yourself. So I would say definitely what Prajwala said, do two NBMEs back to back, or you could like do one NBME, which is like 50 questions per block. So that's about 200 questions, and then do another self-assessment from UWorld, like UWSA one or something, so that you get a proper assessment. Yeah, and always review the self-assessments. Never think that self-assessments are just for testing, like just to give you a 3-digit score. It's always there to show you why you're making some things wrong. And you obviously you can get those things right in the actual exam if you get that on the actual exam. So it's bonus. So never skip or sleep on the NBMEs and the self-assessments. Think that's too much. No, you have to get through those.
Also, I would like to add free 120 is a gold mine. Do not skip
Yeah.
on the free 120. It's like very relevant questions, and there will be a minimum of 4 to 5 questions from there directly.
Yeah, definitely. I agree. And the pattern of questions is the same. Like you get the same way how they ask in the free 120. So definitely recommend free 120 like 1 week before the exam.
Right, right. And like now that step one is pass fail, do you think a step two score is more important? Like some people are planning on giving step two. So would it be better to push the step two and give it before their internship, or maybe take the time and try to get a good score? Like, which do you think is better, the timing or the score?
I would say the score would be the most important thing. So take it when you're ready. But also, something that I've seen most people do is panic postpone. So
Yeah,
they'll be like, I don't want to take it now. And even when they take it the next time, I still don't want to take it. So your knowledge from step one stays fresh only so long. So even though you don't feel you're ready, trust your self-assessments and your UWSAs. And if they tell you you're ready, then you are ready and you're gonna have to take it, because the more you postpone, the more burnout you'll face, and that's not
right,
really a good thing.
right, right. Then anything to add to that? Because yeah,
I totally agree. So basically, you'll be in the anxious state in that by the end of your prep, that you're getting already a 3-digit score from your self-assessments and you don't know how to improve your score. So if you're getting the score that you're expecting or somewhere near that, go ahead and take it. Don't expect like way too much. Like if you're thinking that this is enough for me, like it's okay, you should just go ahead and take it. Stay calm and just take the exam. But if you feel that the specialty that you're opting for and the score, this is not going to make it for you, then
Right.
definitely wait, and like try to improve your score and then take it, I would say. So it's always based on what specialty you want to go into. And if you're okay with the score and the specialty that you're going to, it's always okay to just take it. Never like think that, like I'm gonna crack this and I'm gonna get like a 280. No, don't think like that.
Yeah, I mean, that's the mindset people approach it with. 300 marks, 280 at least. So,
No, I
Yeah,
mean,
that's not
yeah,
gonna
it's
happen.
not. It could
But
happen,
still,
but
of course, aim for the
yeah,
highest score possible because it is
yeah,
still make it or break it. They're trying to make it less that. They're trying to make it more holistic. But how much ever they
yeah.
say and paint the picture of holisticism, they're still going to have your score right there, and they are
right.
human too. So your score really does matter.
I think there was
Your
one
score is
person
something
on. No, please go ahead.
like
Yeah.
the score is something where they use it for just screening, and then later
Mhm.
on, once you get the interview, it's always based on your personality and what you have put into. Is it hard work or is it just fake? So they get to know when they take your interview. So they write up, get to know if you're doing things and the way you are. So all those things matter. Your personality also matters. So never think that score is the last thing. As I already said, like my step one score, I was just shattered, but then I still moved forward. So score is not the end of the world. So even if you get like two, I mean, I'm not gonna like name the score, but even if you're
Yeah,
getting whatever you're getting, it's okay. Like you can still make it.
right.
Yes, I
I think,
completely agree with that. If you've already taken your step two, like whatever score you've gotten, as long as it's in the range of the NRMP statistics, you're okay. You're gonna be fine. Just focus on your holistic application, your CV. That's the most important thing.
sure. I think there was one person on Reddit who just got a 286 or something, and I think that guy just changed all standards that we have now. It's just crazy, I believe.
One more advice that I learned the hard way. Do not like think Reddit is your newspaper or whatever because people on
Don't believe.
Reddit, you
Yeah,
don't know them. They're completely anonymous. So they may be lying, they may be faking, and it's a very
yeah,
skewed curve. Like even if they're truthful, they only put up scores that have, oh, I match with a 286. Oh, I did not match with a 280. Oh, I match with a 210. So all of those are like, unicorns. So they're not like what
go to
everyday
another.
people go through. So
Um, okay. So sorry.
Always take Reddit with a grain of salt. Don't like think that people are so genius. No.
Yeah, I mean, it always seems so improbable when you just go through Reddit and people are like, I had 15 publications at the end of my first year, and I'm like, how are you doing all this? How, what kind of support system did you have, and how important do you think is it in the entire process?
I would like to emphasize like the support system is a very important thing because the common saying that an entire village is what it takes to crack the USMLE. So for me, I mostly like uh, had to go about it on my own, so I know how difficult it was because the previous batch that had cracked the exams were like 3 years, and nobody had done it in the 3 years before my batch. So that was hard for me. And though there definitely were some alumni, as I mentioned, Vishwadeep and the others, who got me started, mostly I had to figure it out on my own, and that was hard. And if you can get hold of somebody, anybody, like even someone you met online, LinkedIn, contacts are a very important part of your USMLE journey. They're not optional, but rather something that you need to match at this point because especially in internal medicine, you have a lot of seats and there is something called signaling from like 2 years previously where you
Right.
have to signal the program of your interest and these days they're only like giving out interviews for the signal program. Some programs are following that, not all the programs. And so having a contact within such a program can be like a really good thing to obtain your interview.
So, did you mean by financial, like support? Did you mean by financial support, or is it like connections? Is that what you're saying?
No, I meant like, just people around you that were helping lift you up when maybe you were feeling a little down. Just friends and family, people that were there to support you through the journey.
Yeah, definitely you need a lot of support for this journey because this is not something that happens with just one exam and you're
Right.
done. It's kind of like takes a while. Like you have to be ready for that, and you should also have support like your family. So I would definitely say my parents were really there for me when I needed. Like when I told them that I'm pushing back my step one exam, they were like, "Yeah, we are totally 100% with you. Like it's okay. Like you can do it." So it's definitely important to have that support system. And also, after a certain while, you also start doing things on your own. So for me, it was like I started working a job. So I realized that I
Mhm.
should also think financially how I can support myself since I can't be asking my parents for it all the time. So that also comes into play. So financially as well, you should be prepared for certain things where you have to pay a lot, like for your application. So you'll be applying for like 200 to 20 programs where you'll need a lot
Mhm.
of money at once. So that's something which you have to plan ahead of time so that you are prepared. So one thing I learned from this journey is to plan things ahead of time so that you don't fall out on things later. But eventually you will fall into some or the other kind of difficulty, but definitely have a backup, like someone to support you when things like that happen. So yeah,
Yeah, that's actually really nice. It's nice to see that people have helped you in this process and that, we can also count on other people to lift us up in times of need.
yeah,
It's a
you do
very,
need
very
a
important concept. Yeah, like you mentioned before, it takes a village.
yes.
Um, and maybe did you do anything at MMC while you were still doing your undergrad?
Do you want to take this, Dayana?
Yeah. So when I was in MMC, after my step one exam during internship, I really wanted to get into research. So I tried a whole bunch of things, started like going to the committees, the ethical committee, and asking them about it, and also asking some professors if they are willing to do it, like if they want to do a research paper with me, and they were supportive such that they would like tell me to come up with a research topic, which was really something new to me, and like I have never done this
Mm-hmm.
before. I didn't know what to do. So I would just resort to some YouTube videos or something like that and come up with a topic. But then I would also realize that there would already be that topic that's already been published. And so I realized that this is something that I need mentorship with. So someone actually approached me during my internal medicine rotation and asked me if I would be willing to collect data for her. So I started doing that so that she could mentor me on how to write a research paper and what are the things that go into the data that we collect and how they process the results. So it was nice during my internship that I got to do that, and I tried to learn on my own with her. So this was Dr. Sumalata, who is a PhD
Right.
student after her DM. So she was doing a PhD in critical care medicine. And so she was the one who approached me, and I was like glad that someone actually,
Mm-hmm.
approached me like this. So these are things that happen. So you go searching for them, but something happens without your notice, so unexpectedly. So that's how I discovered how to write a research paper and how to look up topics that are not really published, and how you can go about it. And there are so many different ways you can publish. It's not just collecting data and like doing the results. It's also like case reports can be published. And also there's meta-analysis where you don't need to like do a lot of data collection. You can also do it by just having an internet and a laptop. So those are things that I learned through my journey. And then I
Right.
discovered some other people, like connections basically matter a lot. So people who are doing USMLE like me, who were also interested in research. So basically, like connections. That's how I got into research.
Yeah. So I wasn't so lucky. So I did try at MMC. I tried during my third year. One thing you could do if you're early enough is the STS, the ICMR short-term student research thing. Definitely go for that if you still can. Uh, that is one of the most supported research programs at MMC. So if you can, definitely do that. If not, you can approach people to like review your work, but to properly get started, you might need the help of a resident, because they would have to do their thesis as well, and you might be able to approach them and ask them if you can help them out and learn how to do a research paper, because that's something that you would have to learn from scratch. There are several YouTube videos as well that you can learn. For me, I did my first research paper after internship. So I had done
Mhm.
like a poster presentation before this in my third year, and that took like a really huge effort, because though people are there to support you, there are also like a lot of obstacles as well in an Indian institution regarding research. So that is something to keep in mind. One more place where I most um, like it was most beneficial for me to get a research done was during my rotations in the US. I always kept my ear out for interesting cases, and I always asked my preceptor, "Can I write this up?" And they were more than happy to help me. So that's one more spot you can get your research done from.
Speaking of rotations, actually, how did you secure like rotations? And were they hands-on? Were they more observerships? And knowing that it's very competitive, how important do you think that maybe learning to handle rejection is?
Okay, so let me dissect that into three questions. So you, yeah, you asked me about how to find the
Okay,
observerships themselves.
maybe I can split it up. Let me just split it up, maybe. So,
No,
how did
that's all
you
right.
find?
Yeah,
Okay.
that's all right. Yeah. So, how to find the observerships? It was COVID time when we were looking, so it was very difficult, but it's a little bit easier now. But I mainly used agencies, and so that's how people normally do it, because now you have no contacts there initially. So I did try cold emailing, but that didn't really work out for me. So I approached agencies, and they were happy to take me on for a short observership. And uh, one thing I would like to add here is that do the cold emailing in March, because that's when people find out that they matched and they leave their fellowships or their research programs or observerships. And that's also when schools start looking. So now cold emailing and applications through the website of the program work. So definitely do that in March of the year
Okay.
you intend to go. Okay. So that's how you find an observership. And what was your next question?
Okay, the next question was knowing that it's very competitive, like it's a very grueling process to even get the observerships. Like, how important do you think it is to handle like rejection? Is it a big thing? Like,
Yes,
you send
definitely.
one
So
email,
uh,
no reply.
rejections is definitely like something you have to face because, as I said, I tried cold emailing a lot. Sometimes you don't hear back at all. Sometimes you hear back and it's a rejection, and and particularly during COVID, it was like a constant stream of rejection, and I really learned to just brush it off because I understood their situation, and it is one spot. So in engineering, like they have a whole class of people going there, and it's quite easy for them. But your spot is very limited. So you have one position for an observership. You have like 5 to 6 positions for a residency. So the value they place on you is very high, and so also is the rejection. So do not take it personally, and like just keep applying to more and more. Eventually, it works, and you only need one.
Hey, Dayana, do you have anything to add to that, maybe?
Yeah, so for me, observerships or externships was mainly based on my visa. So the
Mm-hmm.
one mistake that I did was apply for my visa after my step one exam. And I would suggest that if you're looking for USMLE and you don't have a visa, apply to it ASAP. Like if you have started the process, just apply for it. Doesn't matter when you're going there, or what you're gonna do. Just apply for it with the mindset that you are gonna go there for doing observership because everyone does observerships now. It's not like COVID before, like that you can't travel or anything. You can travel, and everyone does it. So I would say apply for a visa first, and then like later on you can go ahead and look for observerships. First thing I would do is look for any connections there, any kind of relative or anyone there that would be a doctor who would help you get a rotation or in a hospital where you can shadow another doctor in the field that you're interested in. So anything of that sort would help you out. And if that's not happening, if you don't have any connections at all, then start emailing, cold email every single opportunity that you see on LinkedIn, on the websites. So start searching for the programs that you want to apply to, and also looking at if they give an observership in the program. Like the one that I looked up was USF, University of Southern Florida. So that was giving an observership in internal medicine, which needed like I needed to apply to it like almost year before starting my observership. So you have to look for observerships almost like a year before. Like as Prajwala said, start in March. That's really like a really nice way to start. But you can start anytime. So as I said, better is a year before you go for an observership. So start emailing a year before, and then if you get a reply, that's awesome. If you don't, just don't feel bad. It's common. It always happens, and always keep lookout for any connections that you can develop during that process. Even if they reject, like just ask them, like, is there any other position or like any other way that you can do this? So that's what I would say.
How big of a change is it from the Indian healthcare system to the American one? And do they expect different things from doctors there?
Do you want to take this, Diana? Very different for me,
Yeah,
so I'll adapt it.
yeah, I'll just take this question. So when I went for rotations there, it was expected of me to appear a certain way and present myself to patients certain way, and also be polite to patients and ask them if they need anything. So the way you present yourself matters. Not like in India, you can't go however you like. And the second thing is the way you communicate your or ask questions also matters. So during my rotations, I would also make a point that I would ask for feedback early on, ask them if I'm doing something right or if I'm doing something wrong, do I need to change anything early on in my rotation, so I could modify those things early on and not regret doing that in the beginning. And by the end of the rotation, I would always make sure that I would ask for a letter of recommendation. So it was all these things that I felt it was so different from India. In India, I felt that this patient load is a lot more, and so you have to focus on getting things done more than what the patient would think. But here, it's more of like you would the first of my rotations. Um, so during that time, I it was really hectic for me, but still I had to manage to make sure that I was polite to the patient, made sure that they felt comfortable around me and all those things. So that was one thing that I felt was different. And the second thing
Right.
was it's always systematic, and the EMR system is one thing where you have to learn it. Over there, you have to learn how to write a note and what are the different types of EMRs that they use. And if it's in a clinic, then you have to also learn different types of EMR that they have access to in different hospitals, because they have to be connected with different hospitals for the investigations. So that was a
Right.
different thing for me. And the EMR is a big change. So you might think that you know computers, but like in the beginning, you might feel it's kind of like a lot. But as I said, try to ask for feedback early on, and I think it should be good.
Right. So Prajwala, like, are the diseases and the presenting conditions a lot, like, I'm pretty sure epidemiologically there's a lot of difference, right? How does that show up or manifest in pathology? Like, is there a difference in the type of
Yeah, okay. So I was just waiting for you to finish your question. Basically, you asked me like you have a lot of a lot of diseases, and how do they present? Is that what you were asking?
epidemiologically two very different places, common conditions present? Like in India, I feel like we're more infectious disease based, and maybe in the US, it's more lifestyle disorders and things.
Yes, that is true. So, in one of my rotations, I saw them getting a pathology test biopsy done for an insect bite. So,
Oh,
that yeah, those kind of things you definitely don't see in India. In India, it's more like stage 4 cancer and they catch it late. And that's something that I like about the US, that you see a lot of variety and you see a lot of benign conditions in addition to the cancers and that are too late to treat. So they actually make like really good utilization of the services in the way that you can actually make a difference.
right.
So that's something I really appreciate there.
That's actually such a cute, like a cool little tidbit, because I have like 15 different insect bites on my arms and legs, and I'm like, it's getting like,
Yeah, so it turned out it was a spider bite, and the pathologist there was able to
oh
identify
my,
that these were the cellular changes for a spider bite. So yeah, that really blew my mind.
cool. So now we're down to the deep questions. Did you have a plan B?
I definitely didn't have it. I was not going to go back and Like I was set on USMLE, and if I'm doing this, I'm doing this the right way and just going ahead with whatever I could do. So I was never like looking back and seeing if I should do the other plan or whatever the plan B is. So I didn't have a plan B. The only plan B I had was if I didn't match this year, I'm gonna apply again next year and match next year.
Yes. So that was mostly my mindset last year, but then I did end up not matching last year, so I had to figure out my plan B pretty fast. So my intention was always to apply and match again, which I did. But in that moment, there is always doubt, and I feel that having a plan B is a very practical idea because there's always NEET and NICT to fall back on. And the thing that I felt that I did in that situation was right for me because I had I joined AIMS and I got into pathology and something that I could finish off in 3 years. But I also did not want to give up on my dream, so I applied again and matched this time. And I also felt that really added to my CV because it showed them that I was genuinely interested in pathology and that I had actual experience to show this time. And it's something you can talk about in your interviews that this is the specialty that I really want to do, and I've actually done this in like real time, like with responsibility as a resident. So they actually see where you're coming from and you're genuine.
Right. This is actually a question. We had actually put up a poll on our official Instagram page, and one person had asked a very interesting question. So, are medical school marks important in the process in any way?
No.
That is actually a relief. That is such a relief.
Yeah,
Okay.
it's really not.
Okay.
Because mainly they do not know or trust the way we are graded. So
Right.
that's why they just don't consider it.
Right. Dayana, did you have anything to add there?
Yeah, they don't really consider your marks or your grades. Like I said, even step one and step two, they use it just for the screening purposes. They look at your personality and how you present yourself. That's more important to them. And also the communication part is very important for them. So there are other things that they can evaluate on than your med school marks. No.
So we're down to our last question. Given a chance, would you do it all again?
I would, and I did basically
Yeah,
because
you.
yeah. Definitely it was worth it, and even though things had not worked out, I certainly learned a lot about myself, and
Honestly, so inspiring.
yeah, I learned a lot about myself, and throughout this journey, I was not the person that I started out with. So you grow a lot, and whatever the outcome, it's definitely worth it.
Right. And Dayana, any
I
regrets in
totally
the
agree.
process?
No regrets. I definitely would say that I learned a lot from this process. And if I had to do it again, I would do the same exact way as it is. I would never like change a thing because I learned a lot. Basically, I learned how to be patient. I learned how to be resilient, and I learned how to deal with my own anxiety when I needed it to not be the way it is. But unfortunately, it was, but I learned a lot from this process. So I'm so glad that I did choose this path and stuck to it. And I would recommend each one of them who are starting on this journey to do the same, even if it feels hard in certain points of the journey. But you're gonna be shining by the end of it. So don't worry about it. It's just gonna pass. So yeah.
Well, Thank you so much to the both of you. Honestly, you shared some amazing points and amazing experiences. And truly, as a student of MMC, it's so inspiring and motivating to see that, our alumni are off in the world doing cool, amazing things. And, we get to brag about you a little bit. So it's really, really, really awesome. And I just want to thank you both for being here with us today. It's been an absolute pleasure to have you. And just thank you so much.
Thank you,
And
Samhita.
thank
It
you
was
for
really
having us.
a pleasure to be here and talk about stuff and catch up. And I definitely feel free to contact me, like with any questions. You can always WhatsApp me, and I will always be ready to answer your questions. And yeah, please do reach out.
Yeah, thank
Yeah,
you.
anyone who wants to reach out and ask any questions regarding the journey and the process of getting into internal medicine, I'm totally down to help because I know how hard it is, and I know how difficult it would have been if I had not had the support from my seniors, and it's really important. So I'm so totally down to it. But if I'm really bad at messaging, so if I message too late, then I would be sorry already. But yeah, you can definitely contact me.
Thank you so much again. Honestly, an absolute pleasure to have had you here today. So, good night. Thank you.
Thank you.
Thank you.
No.
Good night. Have a great day.
Bye bye. You too.